Today, you and I are going to be watching a video together where my friend and co-founder of the FAI Fix, Shane Dowd, is being interviewed by two physicians who have a podcast called Live Foreverish. They are going to be talking about hip pain, how it can relate to back pain. They're going to be talking about pregnancy and hip pain, how women might have to deal with hip pain a little bit differently, and how they approach getting rid of some of the muscular issues that might lead to hip pain. And Shane is going to give you one of the most powerful, succinct, and useful metaphors for how your body should be valued in your life. I want you to watch through till you get to that part because it is awesome. It is so powerful. It will change how you think about your body, probably, hopefully, forever. All right, without further ado, let's watch the video.
So hips. I've never knew how important they were until recently. Remember I was telling you the story?
Yes.
Yes. So I found out that a significant amount of my lower back pain was actually coming from a left hip that was impinged, that wasn't working right, that was, I don't even know the right words to say. I don't know. It was something like that, right? Mm-hmm. And it wasn't until I started doing specific hip stretching that my back got not 100% better, but significantly better. So I am very excited about this topic.
All right, me too.
So this is a great way to open up an interview about hip pain, right? So you have to understand that if one part of your body is not functioning right, nothing else can function perfectly right. Your hip is such a crucial piece of everything that if your knee or your back need to compensate for that hip, you're going to experience at least some imbalance, if not some outright discomfort. All right, so this doctor, perfect example. Let's keep going.
I started thinking about my hips when I was pregnant. I'm sure they were opening up for a reason. Oh, yeah. But hey, the baby's out. Everything needs to go back to where it was before, and it's not quite there. So maybe we can learn about there.
So this is actually something that's really funny for women. I mean, it's not funny, but it's a challenge, right? For women, when everything loosens up, it can be really challenging to get everything to feel like it's back and stable again, because all those hormones coursing through your body really loosen up a lot of stuff, and your body, it doesn't just snap right back. You actually have to do strength work to really feel like you get that stability back.
So listen, we got an expert, Shane Dowd. He's a certified massage practitioner, strength and conditioning coach, and corrective exercise specialist. He fixed his own hip issues, impingement, and now he helps people all over the world recover from injuries. He's the CEO and founder of GotRom, ROM.com, and the FAIFix.com. Shane, welcome to the show.
So Shane and I have created the FAI Fix program. That's why we're watching this video. He is somebody who had a really jacked up hip. I know this personally. When we first met, his hip was pretty jacked up. And when you hear kind of his story, when you really dive into his story, you understand why we created this program.
I was amazed that when I started focusing on my hips, my back got better. Is that a common thing you hear?
Totally.
Yeah. So tell us a little bit about your story.
My situation was exactly the same as yours. I was getting reoccurring back injuries. So my back was getting hurt over and over again. And I was a strength and conditioning coach, and I was teaching Olympic weightlifting, like how to lift these heavy weights over your head. But even when I would lift light weights over my head, I would get these recurring back injuries. And similar to you, I found out the root cause was the hips. The hips were not moving as well as they needed to. And so the back was compensating and moving more than it should have, and causing these injuries. And so I was told at the time I was going to need surgery for it, but I was like, I'm 26 at the time. That seems way too young to get surgery my hips. So I went down the rabbit hole of mobility work.
Just want to point out, in case you didn't notice, the female physician here in the shot is just kind of shaking her head. I think it's very important for people to recognize that while within the medical world there can seem to be the appearance of consensus, right? You hear from an expert, like you need surgery. It doesn't mean that if you asked every other physician that they would tell you the same thing, especially if they don't make money off of that recommendation. And so you can see, the motherly concern in this female physician just shaking her head like, don't do that. Dude, why would you do that?
So I went down the rabbit hole of mobility work and physical therapy and yoga and massage and spent like $26,000 on all these different therapies. Long story short, fixed my hips, and now I help other people with hip impingement.
You know what I've always wondered is, where did Shane get that $26,000? That's a lot of money.
But luckily, I didn't spend that much money. I just saw a video. I think it was on TikTok. And it was about hip stretch. I thought, well, maybe that's what I should do, right?
Mm-hmm. That is such an amazing story. And I've viewed some of your YouTube videos, and I saw some of those. They're not deadlifts, but the clings, whatever they are, where you go up in the air. It looked scary. And so that is how you kind of suffered your injury from doing that. And you mentioned that you were bedridden for a while as well.
Yeah, for about a month, I was basically bedridden. I couldn't bend over the sink to brush my teeth. My girlfriend at the time was putting on my socks and shoes for about a month because I physically couldn't do it. And that was when I was told, like, hey, your hips are really messed up. You're going to need surgery. And I was like, let me explore some things before I take that kind of drastic option.
So let's just pause here, because let's point out that Shane was in his 20s and was bedridden, and he needed assistance to put on his socks. He couldn't brush his own teeth. That's pretty extreme, right? That's hitting kind of rock bottom, and he didn't let that basically force him into a really drastic decision, right? He recognized, like, I'm in a bad place, but also maybe there's a way out of this that doesn't involve somebody mucking around with a scalpel and carpentry tools inside my body, right? So lesson here.
Yeah, for sure. Well, let's back up. Maybe we need a definition, though, because I'm not even sure if I'm using the word right. Okay. Mm-hmm. You mentioned hip impingement. That was your issue. I'm not sure if I had hip impingement. All I know is stretching just helped. What exactly is hip impingement?
Let's just be clear that if stretching helped, it doesn't even matter, right? Like, we like to throw all these labels and names on top of things, but if you can make your body move better, that's all that matters. Stretching, strengthening, massage, all those things, if they help, it doesn't matter if you have a very precise label for your problem with moving, your discomfort while moving. It doesn't matter. But as humans, we seem to gravitate towards having these diagnostic names. So let's talk about hip impingement.
Yeah, it's basically, it's the layman's term for, when your leg bone is bumping into your pelvis bone, or it's compressing some of the tissues. So if you bring your knee towards your chest and you get like a pinching sensation, there's an impingement happening.
Yeah.
And the modern medical theory is that it's a bone issue. It's like your bones are malformed, which mine are malformed. They're not perfectly spherical ball and socket. And that's what causes the hip impingement. But what's really interesting is that I worked on the tissues, like what you discovered. Oh, stretching actually helps that. So I've got these bad bone shapes, but I did stretching, some self-massage, and strengthening, and was able to solve the problem without shaving the bones. And so that's kind of the big revolutionary thing is it doesn't have to be a surgery to fix the bones to fix a hip impingement. It can be things that are more what you would find in physical therapy and yoga and stretching and massage.
Okay, so you just answered my next question. What were the doctors wanting to do? What kind of procedure? So they were wanting to shave the bone, shave which the hip or the But I guess that's the femur
the ball part.
The ball part.
I just want to point out here,
So they
I
were
love
wanting
that these two are
down.
openly and honestly asking questions. I want to point out, though, that these are practicing physicians. They don't go through
So I guess that's not that's the
what I would call
better of the two
adequate
options versus
anatomical training, and depending on what they practice in, they might not have to deal with bone anatomy much at all. I don't know their background, but in medical schools in the United States barely cover musculoskeletal anatomy. So you can see here for these two very nice physicians, I'm not questioning their competence or anything, but their background knowledge of anatomy is clearly not quite there, right? They don't know the names of the hip joints, right? Like they don't know the bones that make up the hip joint. And so right now they're kind of like, well, it's the bone thing, and then it's the hip thing. Like, is it what do we even mean by the hip, right? So don't assume that because somebody's got initials behind their name that they necessarily know everything they need to know.
The ball part in the hip, so they were wanting to just shave that down a little bit. That sounds...
Yeah.
That sounds crazy. You're right. It sounds crazy.
Whoa.
It is a big
Okay,
surgery.
but I was thinking this is a hip replacement.
Yeah.
So I guess that's the better of the two options versus kind of replacing that whole joint area, shaving it down. But man, that just sounds painful. And so did your doctors, did they say, hey, this is the solution, but maybe you can try a little stretching? You know how sometimes the doctors say it's really not going to work, but if you're going to refuse this surgery, give it a try. Was it that kind of conversation?
Oh, thank goodness. This is some awesome honesty, right? This is the conversation that so many people with hip pain, shoulder pain, back pain have with their physicians. You could try this, but it's not going to work, but go ahead and try it. I'll see you in 3 months, right? Like that kind of condescending BS, frankly, is just so commonplace, and I'm glad this doctor is pointing it out.
Yeah, essentially. I mean, the wild thing to me is that, you just said that sounds really intense. A bone shaving surgery, that's like a big deal. It's not just a quick and easy thing. And yet that's often the first thing that a lot of doctors, not all doctors, will jump to is you need to, get this expensive, invasive bone shaving surgery. And yeah, what they essentially do is they shave the bone to make the ball more spherical, and theoretically that takes care of all of the problems. The only problem with that is that you're not just bones, you're also muscles and tendons and connective tissue that attach and connect to everything. And if you don't learn how to work with that, then just affecting the bone will not be the complete solution.
Amen, Shane. Good job, Shane. Amen.
So you were able to avoid that. So you mentioned some stretching, you mentioned some physical therapy. Tell us a little bit more in detail. What exactly were a couple of the types of stretches you did? I do this, the one I do, and I don't know what it's called, Shane, maybe you do. It's where you're lying flat, and you bring it's my left hip that's bad, right? So I bring my left knee up, and then I just kind of make circular rotations with it. And it and I go slow, and I can stretch it towards the ground and then bring it back up. I don't know if that has a name. Is that the kind of stuff you were doing? And what else were you doing to stretch this area so you avoided surgery?
Mm-hmm. Yeah, well, stretching is a very helpful thing, and it's one of the three big things that I think helps. And there's all kinds of stretches that can be helpful. There's what you were describing, which is kind of like a gentle kind of like hip mobility technique. You can stretch your glutes, you can stretch your hamstrings. Some people have really tight quads from sitting all day at a desk or really sitting for a lifetime, and so our hip flexors and quads get really too tight. And anytime there's not a balance in the length and flexibility of the muscles around your hip joint, something can be pulling the joint out of position and causing your impingement. And once you get it back in position by restoring the flexibility and mobility of the muscles around the joint, the bone on bone, quote, impingement kind of goes away. So I was doing all kinds of different stretching techniques, but also the missing ingredient for me that I think was the missing ingredient from even most physical therapy protocols for hip impingement is what I call targeted tissue work. It's kind of like very precise self-massage. So you've probably seen or heard of like foam rolling or rolling around on some kind of like ball to massage your muscles. It's like a few levels beyond that. You start with a foam roller, you start with like a soft ball, a tennis ball or something, but it progresses way, way deeper than that. And that was one of the missing ingredients for me. So it's like once I added the targeted tissue work, the very precise massage to the stretching became doubly as effective. And then when I added in strengthening exercises, kind of strengthening your glutes, strengthening your hamstrings, kind of to restore the balance of strength around your muscles, that combination, tissue work plus stretching plus strengthening, was kind of the magic fix for me.
Also the magic fix for me, right? And pretty much everybody we talk to, that's it, right? You need to kind of circle through those things and make sure that you're restoring balanced function, balanced movement all over the place. So for really stiff guys, a lot of times it's a lot of targeted tissue work, it's a lot of stretching and some strength work to make sure things are balanced. For ladies who are very, very flexible, which I think I believe they're going to talk about this later, but for ladies who are really flexible, might be a little different, might be a lot more strengthening, a lot more targeted strengthening, still some of the stretching and some of the tissue work, but the mix, the blend, the recipe blend is going to be a little bit different. Anyway, let's get back to it.
What we're talking about now, the hip impingement, going back to my issue, a woman's issue from childbirth or having carried this huge load in your belly for, 9-10 months. Is it the same type of hip concern, or are we talking about something different? Can you describe what's happening in the hips for women from childbirth?
Because it was too easy to become hyper flexible, hyper mobile, with all of these pregnancy hormones making you much more fluid. So often for my women clients who are dealing with hip problems.
Really interesting, though, Shane is going through all the details that are very important for you to know. So if you're a woman and you're pregnant, you're getting so loosey-goosey, it's just too easy. And, stretching more, that doesn't make tight things feel better. Sometimes things actually feel tight and irritable because they're too weak, they're too lengthened. So I've worked with some women through their pregnancies in the past, and they would report doing strength exercises like deadlifts, not to a crazy extreme, but doing deadlifts, doing squats, doing things that turn their muscles on really felt good. Obviously, we weren't having them, lift, 3 times body weight or anything. We're keeping it reasonable, just like a medium, moderate challenge. But that kind of thing would really help because if they're sitting because they can't walk around so much, if they're, just feeling like their glutes are shutting off because they're sitting, their hamstrings are shutting off, their belly is expanding, the muscles around the belly are extending and lengthening, doing some exercise to just make things feel stable helps a lot. And then after the fact, of course, once you're able to get some sleep and the baby lets you get 5 minutes to yourself, of course, all that is very important to do as well.
The women, and especially women in pregnancy, will do a lot more strength and stability work.
Wow.
Very good.
So would that
notes?
be like, I know, hip flexion type of exercises, or is it still like strengthening the glutes? I'm getting my exercise plan, Dr. Mike. Is it glute work? Is it quad work, or more of the machines where you get on and
well, wasn't that Suzanne Summers thing too? Didn't she have like where she did the hip thing back in the 80s?
The Thigh Master.
Something like that.
It can be a lot of different things. It can be some of that Suzanne Summers work. That's what I call isolated strength training, where you're just really working one small muscle group, or that glute machine that you were alluding to at the gym, where you get on it and kind of just press out with your knees and it kind of works the glutes. Those are all fine. They're isolated strength training, but then you want to incorporate that into integrated strength training, which means more complex movement patterns, like the movement patterns that you're going to need to do in your daily life. In the gym, we call it like a deadlift pattern. You're picking something up from the ground, but in your actual life, you call that picking the kids up off the ground, picking the groceries up off the ground. That's the deadlift pattern, and there's more muscles involved. It's a little more. So you start with the isolated stuff, and then you do the more complex stuff like squatting, deadlifting, and lunging, and you get better and better and stronger at those over time, and that will lead to your healthiest, happiest hips.
Mm-hmm.
I love that we're talking about strengthening, right? I mean, Shane, our podcast is called Live Forever-ish, right? It's kind of a little joke, little play on wanting to live long, vibrant, healthy lives. It's not just more years, right? It's good years. And we talk about strength and muscle mass and all that kind of stuff because that's so key.
Right.
So all of this stuff we're saying is probably good even if you don't have an issue, right?
Yes, the stuff is good. Even if you don't have an issue, you need to be strong enough to move your body through space until you die, right? It's very important.
Right? I mean, we should be keeping our muscles strong, keeping our flexibility good. And so Shane, what do you say to that guy? We're gonna go back to the men. No more pregnant people. What do you say to the guy who is like, well, I can't stretch at all. I'm so stiff as a board or something like that. What do you say to that person, and how can they get started to improve that?
Yeah, there's two main ingredients, especially for the stiff as a board guys, because that's where I started at. Like I used to, and I remember my first yoga class, I would do what they called the resting pose in yoga, which is child's pose. And it's supposed to be the easiest, most relaxed kind of easiest position. And it was painful for me and I couldn't even get into it. I wasn't doing like downward facing dog. I was doing downward facing push up because I had no shoulder range of motion. So I was like over here. So I was the stiff as a board guy. And the key for that population is two things. It's one, adding in that targeted tissue work, because usually when men start to stretch, it's like painful. They've got no range of motion. It hurts. It sucks. And it's just like, I'm not going to do this. I quit after my second yoga class because I'm looking at all these bendy people around me and I'm nowhere near it.
People.
And so I just quit. But when I add in, so when you chew up the muscles with some self-massage, they stretch easier. It's like bubble gum. You chew up the bubble gum and it stretches easier. Same thing with the muscles. And so if men will add the targeted tissue work, the stretching will be more comfortable and more effective. So that's one thing. And then the other thing is your range of motion, the length of your muscles, the extensibility of your muscles is governed by your brain. If you're tense and stressed out and kind of like up here with your shoulders up in your ears and just like tense and tight, stretching is going to be very difficult. So any practices that get you to drop and relax and take it easy and chill out, like meditation or breathing practices, those things will make your stretching also, twice as effective.
That makes sense.
So much good advice here. One thing I will point out is, that whole idea of trying to calm your brain and calm your body. For people who are stiff and tight, like I have been historically, the idea that you just need to chill out a little bit can be very difficult. It's a very difficult pill to swallow, and you're like, I don't need that. I'm just going to drop this idea in your head that maybe you do. Okay?
Yeah, that makes sense. Now, just really quick, how many days a week would we need to do this?
Like, how much effort do I got to put into this?
Well, I mean, given that this is the Live Forever-ish podcast and you guys have already talked about, the importance of strength training, and I know you guys talk about walking and all the different healthy habits that one should have, we all have some kind of a physical practice, some kind of a movement practice, like something we do for our bodies on a regular basis. I think if you sprinkle in 10 to 15 minutes of mobility work, most days of the week, let's say 4.
I really want to know what the inside joke was there. Did you see he had to get off camera to laugh away from the microphone and he was pointing at her? What were they laughing about? I really want to know.
The average person thinks that taking care of their body is just going to the gym and then coming back. And that's it. But you wouldn't say if you had a car and someone said, here's your car, the only car that you get for the rest of your life. And you're like, okay, so I'm going to drive that car and sometimes I'm going to drive it fast at the gym, but I'm never in my entire life going to take it to the mechanic to give it a tune-up. That's not a very good strategy. And so...
Boom. I want you, if you take nothing else away from this video, that's it. You have one car for the rest of your life. How are you going to take care of it? Okay? That's it. Walk away from this video with that. This thing you're driving right now that you're occupying, this is the one thing, the one vehicle you get. How are you going to take care of it?
You would, if you only got one car for your whole life, you would take it to the mechanic probably once a week, once every 2 weeks, once a month. Like, the point is regularly. And so having a mobility practice, a body maintenance practice, which is the stretching, the strengthening, and the massage, you would do that on a darn near everyday basis. So that's the recommendation. 4 to 6 days a week of 10 to 15 minutes of mobility work added to your regular fitness kind of exercise routine.
Yeah. A couple more questions. I'm going to ask, I know you want to ask about the mindfulness connection because Crystal's into all that. I want to, so the other thing about living forever is it's not just strength, it's also balance. Balance is so important for people as they get older. We could talk about building muscle, but we don't talk a lot about stretching and stuff, Crystal. Are we missing something in our story if we're not including some of these stretching things you're talking about?
Yeah, when it comes to balance, I mean, obviously how you improve your balance is you do things that put you a little bit off balance, and then you get better at balancing. So it doesn't have to be tightrope walking or anything fancy. Like I told my wife one day, if I could choose one exercise, I could wave a magic wand and have the entire universe, all the people do one strength training exercise for their lower body, it would be some kind of lunging variation. Because you're kind of on one leg, you're lunging forward or backward or something like that, and it's balance training. But at the same time, it's strength training. Yeah. So your question was also, is the stretching a missing component of that? And I would say yes, because if you're lacking range of motion, then you reach your end range, and then you'll kind of like stumble to the side. You'll become unbalanced because you're lacking range of motion. So it plays a part. Part.
Also, if all you do is try to strengthen, and you strengthen yourself to the point of within a limited range of motion, and you keep strengthening within that limited range of motion actually keeps getting more and more limited, right? So if you're not stretching things to make sure that you're maintaining or expanding your range of motion, you will be shrinking it. For most people, there are some people who are super flexible and never lose their flexibility, but for the rest of us, you got to maintain. You have to maintain, otherwise you lose it.
But Shane, there's a problem with lunges. They're hard.
What's the problem?
They're hard. They're tight. It's funny because when you say lunges too, I immediately go back to like high school, like basketball, football. We used to have to do a lot of lunges, especially if you did something bad.
Oh yeah.
We'd have to do lunges, like 50-yard lunges. So it brings back really, really bad memories. But I do know they are great for balance and strength training. You want to talk about the whole thing now?
Yeah, the meditation. And so when we look at the 4 or 5 days, 5-6 days a week, how often
3 for me
are we including the meditation? Because that was a part of your journey. That's how you transformed your body, was that meditation aspect. So what was your strategy? Did you use an app to help you meditate? How many days a week did you do it? And do you still meditate?
I know the answer to this question, and I'm very curious to see how he answers it.
Yeah. I'm a bit of an extreme in the sense that when I try something, I go all in. So like I didn't start with the app and the 5 minutes a day, which is a totally valid recommendation. Like start with 1 minute a day and work your way up to 2, 3, 4, 5. Totally valid. But that's also not me. And so I said, I'm going to go and do a retreat right from the get-go. I've been like reading books about it, reading The Power of Now, reading these books about being in the present moment and the helpfulness of mindfulness and meditation. And I just decided I'm going to go do a retreat. So I did a 10-day retreat, absolutely fell in love with it because the difference in how my brain felt before and after was like worlds apart, because it was 100 hours of meditation in a 10-day period, 10 hours a day.
Whoa.
For 10 days.
That's intense.
And that was
no way.
That is super intense. Shane has also told me to do this. I have not done it yet. But who knows? It might be a good thing to do. But meditating at least, 5 minutes a day, that's definitely doable. That's a lot more doable than disappearing for 10 days from normal life to sit silently with just your breath and your thoughts.
That was 10 years ago, and I've been going to those retreats, 10, 20, 30, 45-day retreats.
No way.
I meditate. Meditate about 2 hours a day, And I'm not saying that that's what everyone needs to do, because that's unrealistic for most people. I just happen to love it. And the more I meditate, the healthier and happier my brain feels.
How about 3 minutes a day for 10 days? That's probably more aligned with what I'm doing. Yeah.
I think so. But
I mean, let's have some compassion for all the physicians out there who are overworked and overscheduled, and many of them just don't have time to take care of themselves, right? So that's a very real struggle for medical professionals. I have friends who are medical professionals, and the schedules that they're forced to keep are kind of insane. So, yeah, 3 minutes for these guys, for you, totally good.
You know, I guess I understand, because you had lost all mobility. You couldn't care for yourself. That's traumatic. And you probably said, okay, I'm going all in. And so I commend you for that.
Yeah.
But I think the 3 to 4 minutes, but Dr. Mike, that's more my style.
Well, actually, here's the good news is you don't have to add any more minutes into your day to have a separate meditation practice unless you feel called to it. That's great. But you can do what I call mobility meditation, which is in those 10 to 15 minutes a day that you're doing stretching, you're doing it with your eyes closed. You're doing it mindfully. You're doing it in a calm down regulated kind of way. So you're getting a 2-for-1, and your mobility work, your stretching is going to be more effective because you're relaxed. And you can't be tense and tight while trying to stretch.
You got to turn the TV off, Crystal. You got to put the music down. You got to put the kids, we got to put Blake, your husband, somewhere else.
Yes. So this is a great tip. Eyes closed, music off, TV definitely off. Please, TV off, phone away, and put your spouse in another room.
Hey, so Shane, just to wrap up, great conversation with you. Thanks for coming on. If you had one thing to say in summary, kind of to our audience, what would it be about strength, stretching, hip impingement? What would be that one word you'd like to leave with?
I think I would leave you with a small, short quote. I don't remember exactly by who it's by, but it says, "The secret of your success is found in your daily routine." If you want to change your life, change something you do daily. Yeah. And so I would encourage everyone to start at least 10 to 15 minutes a day self-care mobility practice that includes some massaging, stretching, and strengthening. And that will have your living as long as it can and feeling as good as it can on that journey.
Live forever-ish.
Love it.
That's what it is.
I almost cried.
No.
That was
But she does cry at a lot of things, so don't get too worked up about that. So this is Shane Dowd.
And that is it. The rest is all closing. So hugest, biggest takeaway was what? It was that you have this vehicle, and you only get this one vehicle for your whole life. So how are you going to take care of it? What else did you take away from this video? Drop me a comment down below. I want to hear what you think. Write me a comment. Tell me, what was the best part of this interview? What did you really enjoy? What kind of rubbed you the wrong way? What rubbed you the right way? What made your body feel better? Drop it all in the comment section down below. Click the like button, subscribe. If you want to support this channel, then please check out the links in the description box for Patreon, patreon.com/uprighthealth, as well as how to donate to support this channel. I really appreciate your support. If you are looking for more videos to help you with your body, please check these out here. And as always, subscribe, please. And as always, I hope you remember that pain sucks, life shouldn't.